want to speak this morning a little bit about the coronavirus. This information is from my own personal research, and I do not represent the medical profession by any means. I am sure you have all heard about the coronavirus outbreak that has occurred in Wuhan, China, and are probably wondering what is the coronavirus. So coronaviruses are a large family of viruses that can cause illnesses ranging from the common cold to more severe illnesses like the Middle Eastern Respiratory Syndrome and the severe acute respiratory syndrome. Coronaviruses are zoonotic viruses, and this means that they are able to be transmitted from animals to humans. And in a statement this week by the World Health Organization, it has stated that there is enough evidence to suggest that the virus can efficiently be transmitted from person to person via an airborne route through coughing and sneezing, or from touching contaminated surfaces or objects, and then touching your eyes, nose, and mouth. There are theories circulating online about how this virus really started to spread, and this has caused unfair criticism of a certain population of people, as one of these theories included a Chinese woman eating bat soup. However, this video was filmed not in China and was in 2016. According to a study done and reported by the BBC, they believe that the virus emerged from illegally traded wildlife at a seafood market in Wuhan. Another issue is the false data and messages that are spreading on social media. This week, I heard a message stating that there are hundreds of thousands of persons that are dropping dead from this virus. However, this is not true, according to reputable, well-known sources. In fact, researchers at the Johns Hopkins Hospital in America reported that the fatality rate of this virus is around 3%, which is 10% lower than some of the other severe illnesses caused by the coronavirus's family, and 40% lower than the Middle Eastern Respiratory Syndrome. And this 3% rate is expected to drop as milder cases are detected and taken into consideration. Persons that are most at risk of being affected severely by this virus are those that are very young in age, those that are older in age, and who has other illnesses that will hamper their body's natural abilities to fight infections. However, most persons are likely to have a mild to moderate form of this virus and will have full recovery. The spread is seemingly limited to family members, healthcare providers, and other close contacts. And this is good news, as it leads the World Health Organization to believe that this virus is very much containable. The incubation period appears to be up to 2 weeks, and this means that the time between when someone would contract the virus or become infected by the virus, the time where they'll start to be symptomatic of the virus, can be up to 2 weeks. So some of these symptoms that patients or persons may present with include fever, cough, shortness of breath. You may feel tired, have muscle pains. Some rarer symptoms include diarrhea and headaches, and some of the more severe symptoms will be with pneumonia. So this does not mean that everyone who presents with these symptoms have the coronavirus. A screening tool being used in America, they have advised their physicians that for persons who present with these symptoms, they are asked if they have recently been to China or if they have been in contact with persons who have recently been to China. And this is very important so that they may have a high index of suspicion as to who actually has the coronavirus versus who have maybe the common cold or another illness that would present similar to this. So at this point, proper precautions will be taken to prevent spread of this, as well as samples taken from the patient to confirm infection by this virus. There is currently no vaccine or antiviral treatment that is effective against this virus, and so preventative measures are very, very important. It is essential that each person tries their best to prevent acquiring and spreading of any viral illness. So some preventative measures that we can do to prevent this spread will include washing our hands after sneezing or coughing. If you have to sneeze or cough, you should do so into a disposable tissue, and after doing this, you discard off the tissue or you sneeze into a flexed elbow. You also want to wash your hands after touching surfaces out in public, when caring for sick persons, before, during, and after preparing food, after eating, and after handling animals or animal waste. Avoid unprotected contact with persons who are ill, and then touching your eyes, nose, and mouth before properly cleaning your hands. If you are caring for someone who is ill, use a proper face mask that will cover your nose and your mouth, and ensure to clean your hands properly with soap and water after, as well as an alcohol-based rub. I cannot stress this enough. Ensure to clean your hands properly. If you are out in public, wash your hands properly and use an alcohol-based rub after touching surfaces and before touching your eyes, nose, and mouth, because as I said before, this is a way that you can contract this virus if someone who has the virus contaminates the surface in the public. So how to wash your hands properly? So by the Center for Disease Control, it was stated that you would wet your hands, use sufficient amount of soap, wash your hands front and back, in between your fingers, tips of your fingers, your thumbs, wrist, and you do this for about 20 seconds before rinsing with water, and then use a dry paper towel to dry your hands and then to take off the tap. So in closing, I'd just like to encourage everyone to practice proper preventative measures and do not always believe all the information that you see on social media, as many of these may be false. So always use reputable and well-known resources for your information. Thank you very much.